We represent over thousands of healthcare facilities globally, 11 million in food purchasing nationally, and here in New England, that's 244 hospitals in particular. With recent healthcare reform, hospitals are looking differently at the way they purchase their food and are starting to look at impacts not only just the healthfulness of the food, but the impacts to the community from which that food comes from. They actually are starting to invest in the health of those communities. And in New England, one of the, the foundations of our industry is the seafood industry. So hospitals have begun to get really involved in prioritizing the sourcing of local, underutilized species that are available in New England waters. We have seen that, the consolidation of the market, we've seen this happen in the dairy industry, also in the poultry industry, and right now, as a result of kind of this interest in regionalizing our food system for climate resilience and for the health of those communities, consolidation, although can provide some efficiency at a great cost of the ability to sustain the food system in the long run in the face of some of these challenges. So as I mentioned, I'm coming to you also as a dietitian who provides recommendations on food and nutrition for the public and on a national scale. And I want to note that our national dietary guidelines, which prioritize all of our nutrition policy nationally, are looking at food beyond just its nutritional composition and actually the health of the ecosystem and the sustainability of that food system in the future. So these are going to be important issues that we can deal with now or later. I think being in the forefront of this council has the opportunity to put forth policy that sets the stage for the rest of the country in terms of diversification and a sharing of the resources for the local communities. Hearing the findings of some of those reports were eye-opening for me. I think some of the things that, first of all, it was somewhat depressing. I think the analysis obviously was a little bit more of a... Oh, sorry. All right, cutting me off.
And I'm sorry, what I'll do is I'm going to make that beep when we're at 2 minutes, so if you could just summarize your point and pass on to the next folk, that'd be great.
Yep.
Sorry about the double beep.
That's okay. You really want me out of here. So no, I guess my closing remark would just be that these institutions are putting their market demand forward to shift from their frozen IQF, squares of seafood and really trying to prioritize and bring the market demand to the New England communities.